And if for some reason he needs extra time, I'll come in and just let you know. He
Okay.
needs another 10 minutes or so.
All right, thank you.
But he should be in right now.
What's his name again?
Razavi.
Razavi. Okay, thank you.
Thank you. I'll see you in a little bit.
Okay. I'm not sure about him. Probably. Razavi. 23, 14, so. I don't remember if I gave them an advance directive.
What is it?
I think I did. Healthcare proxy? I might have for my surgery. I think I did.
Just put not sure in the parentheses. Not sure.
That would affect my bill of care? No.
Oh, that is crazy. Don't want it.
Yeah.
Ms. Woody?
Yes.
I just want to make sure you're filling that out.
Yes.
Fantastic. Work on that now, and then Dr. Razavi should be in just a few minutes for you.
Okay, thank you.
You got it.
He's cute too. He's a little.
That's
He's a little
funny.
people.
Everyone else everywhere is women at fancies, and now they're all men. Reason for visit: breast cancer, medical condition, breast cancer. What the hell? Family history, are you serious?
What do you have?
Lung cancer.
Colon cancer.
Hodgkin's. That
Not
scares me.
Hodgkin's, non-Hodgkin's. Hodgkin's.
Hodgkin's
I get that
lymphoma.
confused every time. I need to let them know all that they're nervous probably that we just are getting in here because of let's see. Don't you think?
My last
Just to
period
ease their
maybe
mind.
was like 12,
Huh?
10, 13, 7, 13. I don't know. I guess my periods are irregular. I don't even know what to call them. And these are the same questions.
They are because you're on the pill, right?
Something.
Just gonna put because of weather. We have not seen a doctor yet.
What time is it? Let's see. 10:05. I don't know how much milligrams.
I'm gonna say in the polar vortex.
Right.
I'm gonna say everybody took a taxi this morning. Please don't respond That's what I wanna say. I'm just in front of you.
Mhm. I don't know what to. I think that's all filled out. I think I had all this stuff. No, I didn't hit this side.
I see Dean and Kathy and Uncle. Mom, Cindy, Steve. And I didn't send Todd because I told him I'd call him because he can't get his text when he's driving.
Percy said to me last night when I forwarded, I don't know when I forwarded. She's like, or yesterday, can you please add Bobby to the list? And I don't know what it was about. It was the notes
for
for
today?
Mom, and I'm like,
Oh, no, I didn't.
she might have meant for that, but I was like,
Okay. And you know you can't add on this, right? You have to go in and start all over. I learned that in your surgery.
no, I know.
Because she texted
I do
me,
know.
and I was like, really? I wanted to kill her because I didn't ever ask for Todd. I just tell Todd.
I know.
Like
It's
you
just
should be able to
forward it him.
communicate with your husband.
Or she should just forward it to him.
Right. Plus Todd can't understand a lot of medical terms, so I have to put in mine. Not that he's dumb, but who doesn't know pseudoephedrine is pseudoephedrine? You know what I'm saying?
Right.
Okay.
Hello,
Hi.
Hi there.
I'm Dr. Razavi. I'm Dr. Nicholas Fellow.
Hi.
How are you
I'm
doing?
Stacy.
Karen
How are you
Taylor.
doing?
My sister.
I'm Lily.
Hi, Lily.
Well,
Lily is
Sorry, I
a
kept you.
Hi.
pre-med student.
Okay.
She wants to join us if it's okay with you.
That's fine.
Perfect.
Sure.
Perfect.
Okay. Thank
So
you.
let me just grab a chair for you.
If you
For
don't-
you, if only was
Yes.
if you were here.
Yeah, no, that's fine.
Yep.
Yeah.
So how are you doing?
I'm doing okay.
Okay. So I went through all of your records, all the studies, pathologies, and also read all the Dr. Vanzi's notes. So I think I have an understanding of what's happening, but let me just review everything with you.
Okay.
And please add if you think that I'm missing something or there's something that I need to note.
Okay.
So the plan is just I talk to you about everything, I get some data, and then the final plan, we're gonna come back with Dr. Dickler and talk to you about all of those.
Okay.
And thanks for
You're welcome.
accepting to participate in this part of our education.
Just one question. Did you get the PET scan too?
We
That
have
just
the PET
came in.
scan.
Okay.
Do you know about the results of the PET scan? Has anyone talked to
Dr.
you about it?
Vanzi called me yesterday evening.
So you have, so you know exactly.
Yeah, she
All right.
wasn't.
A little bit.
Yeah, she wasn't extremely clear about it because she said she wasn't used to
And
seeing.
we are not
that.
very clear about it too, so.
Right.
We
Yes.
are not 100% sure what's happening, so
Okay.
we need a lot more information. So
Okay.
let me just go over everything and then get them. So I understand that you have no past medical history, you were completely healthy, and you had this screening mammogram and they found this lesion
Right.
in the right breast. It was at 9 o'clock, it was like 8 centimeter from the nipple. There was some calcification also, so they did some pressing images, and they did the ultrasound, showed almost the same location, the same lesion, measured 1.2 centimeter to 1.6 centimeter.
Right.
Then on November 20th, you had an ultrasound guided biopsy of that lesion, came back as cancer,
Right.
invasive ductal carcinoma. Then you decided to come over here and you saw Dr. Vanzi on the 3rd of December.
Right.
Dr. Vanzi looked at the images and she decided to go with the MRI of the breast because it was not very clear. It looked like that there are some other things going on with the lesion. So MRI showed 2 suspicious lesions in the right side, almost the same place that the ultrasound showed the lesions, and there was also a suspicious, unidentified, not very clear lesion in the left side. And then you had the MRI guided biopsy.
Actually, when she first saw the MRI, she said there were 4 suspicious on the right side
Okay.
and 1 suspicious on the left.
Yeah, you're right. You're right.
And when
There
she
was
first
2
saw
other
the
ones
MRI.
in the right side as well.
Right.
Slightly away from that the first 2 ones that we saw. There was a right upper outer quadrant and it was a lower outer quadrant. There was also 2 lesions. You're right. And then you had the MRI guided biopsy of those lesions. So 3 of the right side lesions were biopsied and 1 on the left side was biopsied and they did
Right.
clip over there. And 2 out of 3 of those right side ones, they're positive for cancer. The same thing that we saw with the outside review of outside pathology.
Right.
So it was invasive ductal carcinoma and it was hormonal receptor positive, and we're going to talk to you in detail about what is the significance of having an ER positive, PR positive cancer.
Right. I think it was lobular though, not
Correct.
ductal.
Correct.
Okay.
Oh, it has both of the features.
Oh, okay. 'Cause
Yeah,
up until now, I've been
It is
told
it is an
lobular.
invasive ductal carcinoma with mixed ductal and lobular features.
Oh, okay.
So, and I think that was the reason that you decided to have the bilateral mastectomy, having the lobular features in the invasive
Yeah,
ductal.
because up
I think.
until, well, this minute, I've only been told it's lobular, and the biggest distinguishing feature of lobular, apparently,
is
that
being bilateral.
being bilateral and that you can't easily see it on a mammogram.
That's absolutely right. It looks like it's invasive. I just looked at the report. It says invasive ductal carcinoma, but it has ductal and lobular features, so it's one of those mixed ones.
Okay.
And actually explains why you have two-sided and multifocal disease. It was just 2 separate cancers that we saw. So this was hormone receptor positive. So he has the estrogen receptor positive. Was like 99% of the cancer cells have the estrogen receptor, and it was progesterone receptor positive. Also, 40% of them had it. And HER2 was negative, which is actually a good sign because HER2 positive cancers are usually a little more aggressive,
Okay.
and you don't need to get treatments like Herceptin, and you're gonna hear about all of those. So you
Right.
don't need those.
Right.
And then you had the mastectomy on the 13th.
Yes.
So they did a right radical mastectomy and they did the lymph node dissection also. And the left side they did a total mastectomy and they removed 2 or 3 of the lymph nodes. And they saw exactly the same thing with the pathology was the same. They found 2 lesions in the right side. There was a 1.5 centimeters lesion and there was also a 0.7 centimeter lesion, correct?
Yes.
And then the left side was benign, they didn't find anything significant. And then, please just tell me exactly what happened after surgery, how did you recover, how's everything after that?
Well, tomorrow's my 6 weeks, so I've recovered well.
Uh-huh,
I mean, I still just have the, this area where the nodes were taken, axillary
yeah,
nodes, that's probably the most sore.
uh-huh,
But I just came from the plastic surgeon.
Okay.
The healing is going well.
uh-huh,
I still have the pain and the tightness, but I'm gonna have that until I get the permanent implants, I'm
correct.
told.
So,
So, there have been nothing exceptional
Nothing.
there. Right.
okay, so. And have you had any weight loss, fevers, chills?
No, I mean, when I got out of the hospital, I had chill. I think, well, people kept saying it was from the anesthesia, because it was really the first week
Uh-huh,
or so after I would go from hot to cold, really quickly, and I would get chills, then I would warm up, but no fever.
okay. And did you get night sweats as well?
I get hotter at night, I get really
Okay.
warm at night, so, I had a couple of nights of night sweats, but not
No.
consistently.
And before this diagnosis and before having the surgery, you were absolutely fine? No, nothing?
Yeah, I mean, I would get hot at night
Okay,
sometimes.
so you had
I just do that.
But that could be hormone.
That's been pretty much my whole life.
Okay, okay.
I've always gotten really warmer in the night.
The reason I'm asking actually is the findings that we had in the in the PET scan and all of those lymph node involvements can also be explained by lymphoma. So, and some patients with lymphoma actually have those kind of symptoms. So they get night sweats, drenching night sweats, and they get fevers. And
It's not
So
My
that's
mom
what-
had
My mom just
lymphoma
had that.
Yep.
last year.
okay.
So
Hers
yeah,
was like drenching and shaking real bad.
Yeah,
She couldn't-
so you did
that's
not have any
like
No.
symptoms. Okay. And why Dr. Van Zyl ordered the PET scan? What was the reason that she ordered the PET scan?
from my report that came back, she did the sentinel node test,
Yeah.
and that came back positive for cancer. So she did the axillary resection.
Correct.
One of those nodes came back positive for cancer, and in
Yeah.
the report that came back, there's a line in there that said, I can't remember what the line was.
There was invasion
something
outside the
spilled
node.
outside of the node.
Correct.
So that's why she ordered the PET scan.
That's very reasonable. Okay. So let's just go over the PET scan results. How much do you know about the PET scan results?
Well, she called me yesterday, right when I was going into an appointment, so I didn't get to write everything down, and I'm not
Okay.
sure I was taking it all in.
Okay.
But I know that there were nodes that lit up.
Uh-huh.
She said several smaller nodes lit up in my chest cavity and abdominal area,
Correct.
but not in any of my organs.
Correct. Correct.
So that's about what I know.
Yeah, so there are multiple of those lymph nodes. There are maybe 8 or 9 in the, I'm just going to give you exact numbers, and I can give you a copy of the report as well. In the chest, there are 2 of them above the clavicles, and then there are
Above the clavicle?
yeah, above the
She said
clavicles.
below.
Yeah, I thought she said like right here,
Okay.
but
No,
I might have just
just-
not been hearing
yeah,
it right.
Yeah, so just above the clavicles, if you touch it, I'm not sure if you can be able to touch it. We try to find them, and then when I examine you, and then there are a few of them also inside the abdomen. There is a measurement when we look at the PET scans, and PET scan actually measures the activity of the lesion or the mass, and it really depends on you had some glucose that was fluorinated, so it's like a dye, and then that glucose goes to the tumor or cancer, whatever, or any organ, and then based on the activity, how active they are and how much glucose they intake, they light up in the scan, and then we get the CT scan at the same time and fuse the images of that lighting up based on the glucose intake with this, we call that FDG, and then we look at it and then we score it. We get rid of the noise, the radiologists get rid of the noise, and they look at it to see how active it is. And then we come up with a number that tells us how active is that lesion. And we call it SUV. So that SUV, for most of the lesions, were relatively low. So it was around, some of them 3, the maximum inside the cavities was like 5. So it's a low activity for the lymph nodes. The one on the right side above the clavicle, the supraclavicular one, the one above the clavicle, that one was 12.7. That was the most active one.
What's the range?
The range can go up in some of the cancers, goes to 30s.
Okay.
So usually less than 15 we consider them, low FDG avidity, and it really depends on type of cancer that you're dealing with, and we are not 100% sure, and because we're not 100% sure what we're dealing with now, and I think Dr. Dickler is going to come over here and talk to you what's going to be the approach, but we definitely need some sampling and some tissue biopsy of at least 1 or 2 of them. So we probably tried with one which is more accessible, and then depends on the results of that biopsy, decide to get more biopsies from the other ones.
Okay.
So she already talked to the interventional radiologist to see exactly which ones are more suitable. It looks like that these ones over here are more accessible for biopsy, and they're easier, less risk, and the radiologist can just go easily find them, get a core biopsy. And then the other ones, there's a small risk associated with them because it's an invasive procedure.
Okay.
So probably we start with biopsying just one of them first, and then we go based on the result, decide to have more biopsies done or not. But it's not very clear that what's happening here. It's very possible that you had one of those low-grade lymphomas and you have a lymphoma history in the family, and those are very very indolent cancers. They just grow very slowly for many years, and then at some point you get a scan for some reason. For example, you develop breast cancer, you get a scan, and you find that you have all of those lymph nodes. Otherwise, you would have found them maybe 5-10 years from now. So some of the lymphoma. But if it's a breast cancer, it's a different issue. It's considered to be a metastatic breast cancer. So it's very, very important for us to understand exactly what's happening here. And radiologist, actually, I think Dr. Dickler just talked to the radiologist last night to again look at the images to see if it looks more like a lymphoma or breast cancer. They're not sure. They think probably they look more like lymphoma, but we need tissue to know exactly what's happening.
So are you thinking it would be better to have a separate lymphoma plus a breast cancer, or?
That again really depends on dealing with one thing is always easier. But really depends on what type of lymphoma, if it's a lymphoma, what type of lymphoma we're dealing with, because lymphoma is a very, very diverse diagnosis. It goes from lymphoma that doesn't change the course of life expectancy of the patient. You can live 40 years with them without even having a problem, to some aggressive ones, and we don't know what we're dealing with here. And with breast cancer, again, it's another issue. I think at this time it's not very clear what we're dealing with. So let me just ask you a little bit more questions about, get more data before Dr. Dickler comes over here. So have you had any surgeries prior to this?
Just the wrist surgery 6 years ago or so.
Okay. And you never had diabetes, high blood pressure?
Yeah.
Heart disease, no problems?
I mean, I have mitral valve prolapse.
Okay.
And this past year, my cardiologist said he thinks it's a possibility. He thinks I have AFib because I've had two situations in the last 4.5 years where my heart has gone really out of control. The reason he doesn't know if it's AFib for sure is, he said, unless I'm ever standing outside of a hospital and can get hooked up to an EKG machine at that minute, they would never be able to diagnose.
And how often do you get them?
I only have had it twice in almost 5 years now.
And did you measure your pulse to see exactly how fast it is?
No, because it was so erratic. Like, we couldn't get a pulse. And my mom's a nurse. We just couldn't get a pulse read. She was there for the first
But you were
one.
conscious?
Mm-hmm.
Okay.
I was.
Okay. Okay. And how long did it last?
Yeah. The first one lasted, no, it lasted 4 hours. Like, we were going to the ER.
And in the ER, when you arrived, it resolved and they couldn't do
No,
anything?
we actually, when I was changing, when I was changing it, it went back into rhythm.
Oh.
So we didn't make it to the ER.
Okay, I see. Okay. All right. It's possible. It's possible. But having it sometimes if it was more frequent, they could do something to like Holter monitoring or some monitors that
They
you can
did the
carry
Holter
that.
monitoring after the first one. I wore a
Okay.
Holter monitor for a month, but there was nothing.
Oh,
So, and I've done the 2-day ones and the,
you did a 2-day one, it was negative, then you did the 1 month one, that was regular.
yeah,
And both of them were negative.
yes.
All right. And the good thing is that the echocardiogram that we did here was absolutely normal.
Good.
So showed nothing actually.
Good.
Your heart, everything was moving perfectly, and then your heart was pumping normally, so
Good.
everything was good. And we didn't see significant mitral valve prolapse as well. So,
Good.
so that's good.
Did you see mitral valve at all, or just not significant?
I looked at part of the report. They didn't even talk about mitral valve prolapse.
That's good.
I will get back to you.
Okay.
If there was any mild one that they didn't put in
Yeah.
the final report. Sometimes they just mention it as a line.
Yeah.
Okay. Have you ever been pregnant?
No.
When was the first time that you had your menstruation? What age?
I don't know.
Right?
Maybe 8th grade, how old are you there?
13?
13 maybe, 12 or 13.
Yes.
12 or 13,
Yeah,
okay.
That's a guess.
Yeah.
Yeah.
So, and I gathered from Dr. Van Zisno that you were on Yasmin when you came here.
I was.
So, how long you were on it, and how
Oh
many
gosh,
years?
I was probably on it at least 10 years. I was on it. It was helping with my migraines and skin too.
Okay.
So I think at least 10 years.
Okay, and before that you were on any other oral contraceptives or not?
No, I mean I switched a few times, but Yasmin was definitely the longest. I'm trying to remember what other ones I had.
Mm-hmm. Just tell me for how many years prior to Yasmin you were on orals.
I mean I think I might have been. Maybe I started when I was 30 or 31.
Okay.
So what is that? Oh,
You're
13
44 now.
13 years, yeah.
13, yeah. Okay. When was your last pap smear and pelvic exam?
July of 2013.
All right. Have you ever had a colonoscopy?
No. Endoscopy, but not a colonoscopy.
Why did you get the endoscopy?
When?
Why did you have it? And
Because
when?
I have acid reflux.
Okay.
I have GERD.
Oh, you
Actually,
have
it's a
GERD.
lovely word.
Yeah.
GERD. Yeah.
A gastroesophageal reflux disease. So, and it was positive. What did the endoscopy show?
That's what showed the GERD.
Oh, showed just the GERD.
Yeah. And I think there might have been a few inflammations that they biopsied in.
Okay. Biopsy was benign, I get
Yes.
that. And when was it?
Thinking maybe 5 or 6 years ago.
Looks like that you have a significant family history of cancer.
Mhm.
So let's just go over all of them. So your mother was diagnosed with Hodgkin's, and how old was she when she was diagnosed?
74.
So she completed her treatment and she's now in remission.
Mm-hmm. Yes.
All right. What about your father?
Lung cancer.
He was a smoker.
He was a smoker.
At what age he was diagnosed?
64.
How old is he now?
He passed away.
He passed away from lung
Yeah.
cancer. Okay. How many siblings do you have?
5. 4 sisters, 1 brother.
And how are they doing?
I'm sorry?
How are they doing?
They're good.
We're good.
No?
Yeah.
No problem, no nothing.
No,
Okay.
thank God.
And then your grandmother from the father's side had breast cancer.
Yes.
How old was she when she was diagnosed?
She was in her 70s. I don't remember exactly.
Okay.
And she had a mastectomy on one side. She did not pass away from it.
Okay. So she died of heart disease. Why did she die?
Stroke. Was it a stroke?
I think she had a massive heart attack.
Okay.
It was all of a
It was her
sudden.
heart, yeah.
Yeah.
Okay. And what else?
I have an aunt on my mom's side,
Okay.
colon cancer.
How old was she when she was diagnosed?
I think I wrote this down somewhere. I think she was 72 when she was diagnosed,
Okay.
and I think she was 77
I thought she was
when she
78.
passed away, or 78.
Okay.
So I think on the genetic thing, I wrote this down.
All right. What about your grandfathers?
Both lung cancer,
Oh.
and they were both miners, coal miners, and they also smoked when they were younger.
Your father was also a minor?
Yes.
Yeah, but he didn't spend very much time in the mines. But yes.
When he was younger.
What kind of mine they worked at?
Coal mine.
gold mine. All right. So do you know if anyone in the family has ever been tested for cancer genetics?
I took the BRCA
Okay,
test before my surgery.
okay.
I was negative.
Oh.
And Dr. Van Zee also wants me to see a geneticist. I just filled out the
Yeah.
paperwork.
You definitely need to see a geneticist. There are some of them that looks like that there's some of the cancers that are related to exposure to smoking and mine and working in the coal mine, but definitely you need to talk to someone and then probably have a more extensive genotyping, what we call genetic testing, and then we'll talk to you in detail about what we do. These days we actually do whole genome analysis. We sequence the whole genome, and they talk to you actually exactly how much of an information you want to know, and there's a lot of things that are happening now, and it's all ongoing.
Yeah.
Because we learn about the significance of the mutations in the genes, and then you may be more susceptible to develop some diseases that we don't know of now, or some of them that you don't want to know about. So they will ask you in detail exactly how much of that information you want to know. But
How do they do the testing?
So sometimes they get a blood test, or sometimes they just get a swab from your mouth, and we gather the cells, and we just sequence the DNA.
Okay. There's one more on there. My first cousin on my mom's side, had Ewing sarcoma,
Oh, Ewing sarcoma.
bone cancer. When he was 4, he got diagnosed. Passed away when he was 6.
Okay. Let me just add here BRC negative. Was it tested here or?
No, it was tested in North Carolina, and I was
Do you have a
hoping for-
report so that
You
you
do.
can?
You have the report.
You have the report?
The report should be in the system.
Oh.
I know Dr. Van Zee received it.
Okay, so maybe Dr. Vance have it. All right. Have you ever smoked?
No.
How much do you drink?
Depends on the week, I guess, if I have dinners. I'd say 3 to 4 glasses a week.
And what's your job and what do you do?
I'm a lawyer. I work for an insurance company.
Okay. Who do you live with?
Myself,
And where do you live?
New York.
Here in the
Yeah,
city?
in the city.
All right. Very good. So, I guess we can go now and examine you, and then we come back here with Dr. Diegler to discuss all the plans and.
Okay, one question. In the
Okay.
PET scan where the lymph nodes are,
Okay.
can you tell if it's in the tissue or
No, they
where?
are lymph nodes. They are not in the bone.
Okay.
They are separate from the bone. So, you know what are the lymph nodes?
I mean, I guess it,
Yeah.
I'm not,
And so, did you say how many were in the abdomen?
I can give you the actual
Okay.
report if you
It's
want
like
the
that.
report.
Yeah,
Yeah.
it's above the clavicle, I just.
Yeah, so I have actually a copy of the report here.
yeah, if we can have a copy of the report, that would be good.
Yeah, maybe 2, 4, 6. Actually, the number doesn't matter as much.
Okay.
As
As
size.
SUV
Okay.
and size are important. If you have, you have significant numbers. It's just not like 1 or 2.
Okay.
But the good thing that I'm not sure. I don't want to say anything.
Okay.
So I think it sounds like there's 2 things going on, or at least looks like a low-grade lymphoma from my standpoint. But definitely we need someone more experienced to look at it and get some tissue.
And you said something about a CAT scan to compare it, so you would order.
So the CAT scan was done at the same time.
To get it.
So when you had the
Okay,
PET
so I
scan,
didn't
when you had the
realize
PET
that.
scan, CAT scan was done at the same time.
Oh, I didn't realize that.
So yeah, so that machine does the CAT scanning and also do the
Oh.
scanning. Both of them get done at the same time.
I didn't realize that. Good.
Yeah, so we scanned you head to toe.
Okay.
Yeah.
So you don't need that test?
We don't need that test.
Okay.
Probably you need another CT scan later if they want to do biopsy, or there's a biopsy that needs to be done of one of them that they are inside. Usually we do them CT guided. So you go under the CT scan, and the radiologist goes with the needle under the CT to find the mass.
Okay.
But that's down the line.
Okay.
All right. Thank you very much. So we're just gonna go and let me just find the room for you,
Okay.
and then you come back.
Oh,
We'll come back,
Yeah.
let you know, we'll leave your
Go
coat,
to.
or no, can we bring our coats
I
and
don't
stuff?
think Barry would tell us.
Cause somebody else might use this room, right?
They'll most likely bring you right back to this room, but bring your jackets just to
Okay.
be safe, cause there's chairs in there.
I thought he didn't know what room we were going to yet. Ah, thank you.
Sure.